Hi, Mitch here, a retired pharmacist with another preventive health video. This time I decided to explain different eye diseases rather than discuss the preventive eye health measures as in my last video. The first eye disease to discuss is cataracts. Cataracts are cloudy lenses that occur with aging. Blurred vision, increased glare, and difficulty with color differentiation occurs. UVA and UVB, smoking, increased free radicals, and advanced glycation end products from a sugary diet makes lenses cloud faster and at an earlier age. Diabetic retinopathy is the next eye disease to discuss. This complication occurs mostly in the diabetic patient. Retinal blood vessels leak or become blocked, destroying the retina, optic nerve, and impairing vision. This disease can lead to blindness. The retina normally communicates to the optic nerve and then to the brain in order to see. Symptoms include blurred vision, floaters, and total vision loss. Excess sugar or carbohydrate consumption by diabetics causes advanced glycation end products. AGEs, as they are called, are sugars that bind to cellular proteins without enzymatic reaction and accumulate in the blood vessel walls, leading to damage to the retina and optic nerve. Loss of protein function and impaired elasticity of retinal tissues and optic nerve tissues. Macular degeneration is the next eye disease of concern. The macula is a small area in the center of the retina that helps you to see objects in front of you. The macula is responsible for sharp detail and color. The macula helps us to see while driving, reading, and the detail in people's faces. Small yellow deposits or leaky blood vessels behind the retina causes the macular degeneration itself. Again, in diabetics, we have too much advanced glycation end products from excess sugars and carbohydrates in the diet, which bind to proteins in the macular area without enzymatic reaction, leading to damage to the blood vessel walls, protein malfunction, impaired elasticity of tissues, and optic nerve damage. Eating green leafy vegetables can help, and also taking the antioxidants lutein and zeaxanthin, which have been proven to work. So that can help at least to decrease it a little bit. The next eye disease of great concern is glaucoma. Glaucoma is caused by a buildup of aqueous humor fluid in front of the lenses. There are mesh-like channels which normally allow drainage of these fluids but become blocked or too much fluid is produced, causing the vitreous body, which is behind the lens, to increase in pressure to the point of retinal and optic damage. The symptoms include eye redness, cloudy cornea, eye pain, blurred vision, halos, loss of peripheral vision, and even blindness. Again, we add to this problem in the diabetic patient with advanced glycation end products from eating too many sugars and carbohydrates. Abbreviated AGEs, as they are called, are destroying the blood vessel walls, retina, and optic nerve by impairing protein function and changing elasticity of the optic tissues. Floaters are the next issue I wanted to discuss. Floaters are specks or dots that appear and float in our vision. The vitreous humor gel, which is located behind the lenses of the eyes, begins to liquefy from a gel, and it pulls away from the retina. This is normal with an aging patient. The exception is if the gel-like material pulls part of the retina with it. This is called a retinal tear or detachment. This can cause macular holes versus what we already discussed was macular degeneration. It's actual hole. Dry eye syndrome is another eye condition that can occur. Usually with age, there is a decrease in the lacrimal fluid and the meibomian oil gland fluids, which you need to prevent dry eye syndrome. The eyelids many times become inflamed, irritated, causing burning, dryness, and itching. Blurred vision can also occur. Many times, Bacterium bacillus, that's mainly that specific bacteria, and Demodex mites that normally habitate in our eyelids multiply out of control, causing the oil ducts to be blocked. This problem leads to a deficiency in the mixture of water and oil eye fluids, leading to dry eye syndrome. A simple product, HOCl 0.02%, sprayed on eyelids can alleviate this problem. The last issue I wanted to discuss was the difference between two types of farsightedness. There's hyperopia and presbyopia. These are many times confused. Presbyopia is the gradual loss of the ability to focus on near objects and usually starts at about 40 years of age and worsens to 65. Also called age-related farsightedness because it's based on your age. The lenses of the eyes begin to harden and become less flexible. The lenses have trouble changing in shape to focus on close-up images. The patient's ability to see far away is usually not affected. Hyperopia is another form of farsightedness where you can see objects at a distance but have to squint to focus on objects nearby. The problem is caused by the eyeballs being shorter than normal, or the cornea of the eye is not curved enough to focus correctly. From this, you can see why there is two causes of farsightedness with two different medical conditions. This is all I have for today. Thank you for watching and listening to my video. I hope you enjoyed the content. Please give me a thumbs up and subscribe to my channel. Mitch the Retired Pharmacist, signing out.